Hi, this is Dr. Ward. I just wanted to review some post-op instructions for sinus augmentation surgery. First, I want to make sure that you review the dental surgery post-op video along with all the written instructions. But these are some instructions additional to the regular dental surgeries. Just in terms of what we've done today, basically there's an air space, your maxillary sinus, that's grown and it's taken the place of where you used to have bone. And we need bone to surround the implant so it can handle the mechanical forces and stresses involved in chewing and functioning. So that air space we have to augment. Either we go through the hole where we place the implant and we push bone up from the bottom and we kind of dome up the bone, or we go laterally and approach the sinus from the outside, adding bone to the outside, and then we can add more volume when I add a window like that. Depending on your situation, it's going to be one of two different ways. But there's a membrane inside of that sinus that can be torn during surgery. So that's kind of your first concern. That's not uncommon for it to happen. It's not a major event. Just how do we manage it? So in general, I'll tell you just to avoid blowing your nose or sneezing and holding your nose, diving, anything that's going to add pressure in there, because that increased pressure can cause that graft to penetrate through that membrane more if it's torn. If you have bleeding through your nose, or if it's something where you have particulate or some things coming out your nose, I definitely want you to call me and let me know if that's the situation, because that just means some of it's leaking through that membrane. Ultimately, the membrane's going to heal almost always. It's just a matter of making sure that we manage it well. So again, similar to the dental surgery, I want your head elevated. We just don't want lots of pressures in there. The wound itself, we want to leave closed. And then, in Oklahoma particularly, we have a lot of allergies and those sort of things that a lot of times I'll recommend a decongestant to kind of help dry that out. And again, we'll evaluate your medical history. If it's contraindicated, I'm going to let you know. But in general, a decongestant just to keep you from having runny nose or sneezing, it just helps the situation. I don't want you drinking through straws and pulling a lot of pressure. There are antibiotics that you'll be prescribed, so definitely take those. And if appropriate, there'll be steroids and some other medicines that I'll give you. And generally, how long do I not blow my nose with that? It's about a month that I want you to avoid that. Also, let's see, bearing down when you're lifting heavy loads, anything that you're going to put a lot of pressures, blowing on balloons, playing musical instruments, anything where there's air being blown, we have to be cautious with that. And so depending on your situation and the type of surgery they did, for about a month, we want to avoid those things. Whether or not you wear your prosthesis or not, I will have gone over individually, but make sure that we aren't putting pressure on the wound itself. We don't want that to open up and then that we can lose the graft and the surgery doesn't do as well as we wanted. So please call the office if you end up having a fever over 101 degrees, any particulate coming out of your mouth, congestion, swelling, increased swelling. There's going to be a little bit of swelling after any surgery. Obviously, you're going to ice and take your medications, but if there's significant swelling that you can see in the mirror and it's definitely asymmetric, I definitely want you to let me know. If you touch the area and it's warm to touch, definitely call and let me know. Normally with antibiotics that you're taking, you're not going to get any kind of infection for the first week anyway because you're on the antibiotic. So it's not something I commonly see, so let me know if any of those things happen. Generally, the grafts mature in 4 to 6 months. At that point, we can either place the implant, or if I was able to place the implant at the same time, then we could start making the tooth. So all that's individual, but hopefully this helps you with the sinus augmentation surgery.